Imagine a life where every breath is a struggle. Imagine feeling like you're breathing through a straw, your chest tight, your energy drained. This is the reality for millions of Canadians living with COPD. This chronic lung disease makes it difficult to breathe, impacting every aspect of life. COPD casts a long shadow, often leading to anxiety, depression, and the loss of independence, but there is hope. Smoking cessation programs, a cornerstone of COPD management, offer a lifeline. By quitting smoking, individuals with COPD can slow the disease progression, improve their quality of life, and embrace a brighter future. The journey may be challenging, but it is possible to breathe easier again. By understanding COPD and embracing smoking cessation, we can empower ourselves and our loved ones to live fuller, healthier lives. This is a call to action.
So you might ask yourself, what is COPD? COPD is a group of lung diseases that block airway and make breathing difficult. Emphysema and chronic bronchitis are two most common conditions under COPD umbrella. Emphysema damages the air sacs in the lungs, reducing the elasticity and making it harder to exhale. Chronic bronchitis, on the other hand, causes inflammation and mucus buildup in the airways, leading to persistent coughing and shortness of breath. The early stages of COPD might manifest as a persistent cough, often dismissed as a smoker's cough. As the disease progresses, shortness of breath, especially during physical activity, becomes more prominent. Wheezing, chest tightness, and frequent respiratory infections are also common symptoms. COPD is a progressive disease, meaning it worsens over time. In its later stages, even simple tasks like walking or talking can become extremely difficult. Individuals with severe COPD may require supplemental oxygen to breathe comfortably, and understanding the progression of COPD is crucial for early diagnosis, timely interventions, and effective management of the disease.
So, when it comes to smoking impact on lung health, smoking reigns supreme as the primary culprit. In Canada, smoking is responsible for approximately 80% of COPD cases. The toxic chemical in cigarette smoke unleashes a cascade of damage within the lungs, setting the stage for this disease. These harmful chemicals inflame the airways, leading to chronic bronchitis. Over time, they destroy the delicate air sac responsible for gas exchange, causing emphysema. The damage is often irreversible, highlighting the importance of prevention and early intervention. The statistics paint a grim picture. According to the Canadian Lung Association, 1 in 4 Canadians is currently or is at risk of developing COPD. The economic burden of COPD is also substantial, costing the Canadian healthcare system billions of dollars annually. The good news is that quitting smoking, even later in life, highly slows the progression of COPD and improves overall health outcomes.
Quitting smoking is often the single most important step individuals with COPD can take to improve their health and well-being. Fortunately, Canada boasts a comprehensive network of smoking cessation programs and resources designed to support individuals on their journey to becoming smoke-free. From coast to coast, Canadians have access to a variety of evidence-based programs tailored to their individual needs. Quitlines like National Smokers Helpline offer confidential telephone counseling and support. Nicotine replacement therapy, available in various forms like patches and gums, helps manage withdrawal symptoms. Innovative mobile phones provide support, tracking progress and offering coping mechanisms. Community-based programs connect individuals with trained professionals and peer support groups. Many healthcare providers also offer counseling and prescribe medication to aid in smoking cessation. These resources, combined with determination and support, empower Canadians to break free from the chains of nicotine addiction.
Meet Margaret, a vibrant grandmother from Nova Scotia, who found herself battling COPD in her late 50s. A lifelong smoker, Margaret had always dismissed the persistent cough and occasional breathlessness as just part of getting older. However, when simple tasks like climbing stairs left her gasping for air, she knew something was seriously wrong. Diagnosed with COPD, Margaret was devastated. She felt trapped, her world shrinking with her labor breath. Her doctor emphasized the urgency of quitting smoking, recommending she contact the Smokers Helpline. Initially hesitant, Margaret decided to give it a try. The support she received was transformative. The counselors listened patiently, offering encouragement and practical strategies to cope with cravings. Margaret also started using nicotine patches, which significantly reduced her withdrawal symptoms. It wasn't easy, but with the unwavering support of the Smokers Helpline, Margaret was able to quit smoking for good. Today, she's an advocate for smoking cessation, sharing her story to inspire others to reclaim their health and embrace a brighter, smoke-free future.
Nurses play a pivotal role in the fight against COPD, serving as educators, advocates, and compassionate caregivers for individuals and families impacted by this chronic disease. From early detection and diagnosis to ongoing management and support, nurses are essential members of COPD care team. In hospitals and clinics, nurses educate patients about COPD, its risk factors, and the importance of smoking cessation. They provide guidance on managing symptoms, using inhalers correctly, and adopting lifestyle modifications to improve lung functions. Nurses also play a crucial role in connecting patients with community resources such as pulmonary rehabilitation programs and support groups. Their expertise extends beyond clinical settings. Nurses advocate for policies that promote lung health, such as smoke-free environments and increased funding for COPD research. They also provide education to future healthcare professionals about COPD.
COPD is a preventable tragedy, and it's within our power to create a future where every breath is a celebration of health and vitality. These require a collective effort, a commitment from individuals, communities, and healthcare professionals alike. We must prioritize education, raising awareness about COPD, its risk factor, and the devastating impact of smoking. Thank you for your attention.